SIBO stands for Small Intestinal Bacterial Overgrowth. It's considered one of the most common underlying causes of IBS. So IBS is irritable bowel syndrome. It's usually the diagnosis that people will end up with when they see their doctor and they're saying, something's wrong with my digestion. Their doctor does some basic testing of them and says, oh, well, nothing's wrong with you. But things aren't quite working correctly. So it's not a disease, but it's a dysfunction. So SIBO is an underlying cause of IBS that can be cured. And addressing SIBO does often lead to curing of IBS. So the first thing would be that we would discuss their symptoms, any testing they've done to date, anything they've tried in terms of digestion to improve their symptoms, what's worked, what hasn't worked. We would test them for SIBO. There's different types of SIBO, and depending on the different types, there's different herbs you might use. So there's kind of 3 phases to treatment of SIBO. There's the prep phase where we get the body ready to eradicate that overgrowth of bacteria, which is in the wrong place. There's overgrowth of bacteria into the small intestine, which disrupts normal digestion. So there's preparation for that, which is usually maybe a couple weeks in typical cases. And then we might spend anywhere from 2 weeks to maybe maximum of 6 weeks in a typical case doing what's called eradication. So we use herbs to get rid of that bacterial overgrowth. And then the last phase is recovery phase. So during that phase, now that we've eradicated that bacterial overgrowth, we actually address what's the root cause of SIBO. So the root cause of SIBO is a dysfunction in the normal movement of food through the digestive system. So we reestablish the normal function of digestion, which then prevents the recurrence of SIBO. And then people often can go back to eating a more varied diet without having symptoms.